Hi, welcome back, everybody. This is new this morning. The race is on around the world trying to develop an approved COVID-19 vaccine. And that includes with some scientists right here in Western New York. The problem, though, is that only about half of Americans say they would actually get that vaccine. That's from the Associated Press. The reason is uncertainty. Many wonder how safe it would be since it was put on the fast track. But the National Institute of Health wants to assure people that they are not cutting corners. And health experts say that developing this vaccine and creating immunity to the disease is key to moving forward here. Rochester General Hospital is one of 4 sites in the country testing one potential vaccine. So I spoke with a Pittsford man who's taking part in that study, and he told me why he's doing it.
Being in good health, I feel it's the least I can do to help others.
Ray Grosserith will tell you he's just doing his part to help during this pandemic. The 70-year-old from Pittsford is one of 90 volunteers taking part in a COVID-19 vaccine study at Rochester General Hospital.
It's not a live virus, obviously. It will be a vaccine that over time will hopefully produce antibodies.
Ray found out about the trial on social media and reached out. He'll be part of a research study involving 2 companies, Pfizer and BioNTech. They're working together to develop a vaccine for COVID-19.
I'm 70 years old, so I'll be in the second stage, which is for people in the ages 55 to 85.
No one in Ray's life has been directly affected by COVID-19, but he says he has an idea of what families of sick loved ones are going through. 2 years ago, Brenda, his wife of 25 years, came down with pneumonia and got so sick she ended up on a ventilator.
She had multiple organ failures. She was on a ventilator in an intensive care unit for about 6 weeks.
She's since recovered, but it's something Ray says will never leave him.
It was a horrible experience, but at least I was able to visit her every day. Unfortunately, for a lot of people with family members experiencing terminal complications in hospitals, they're not allowed to visit them.
That's part of the reason why he decided to be part of this trial. He'll be tested for antibodies soon, and if he doesn't have them, he'll move on to the first stage of the test and be given either a vaccine or the placebo.
If I can do anything at all to lead toward a better future with this virus, I certainly want to do that.
So Ray tells me if he is selected to keep moving forward in this trial, he'll have 11 follow-up visits. Now, the idea is to see if and when he would develop antibodies to COVID-19 and then how long they'd stay in his system, because as we know, we don't have answers to that right now. We don't know how long those antibodies stay after someone develops the virus or is exposed to it.